This is Sarah Meixel with Pigsite, working in collaboration with LifeStart Swine. And today we're online with Dr. Lluís Fabà. He is a veterinarian and swine researcher with Trow Nutrition. Lluís has worked with Trow Nutrition for 6 years, and his past research is focused on gilt and sow lameness and early post-weaning feed intake. Thanks for being with us, Lluís.
Hey, Sarah, I'm happy to be here with you.
Great. Well, I really appreciate your time today. We're going to start talking about lameness. And so let's start with at the very beginning. Why is lameness so important?
Well, first, let me say that this is something I did during my PhD, and lameness is still a big problem. So I didn't manage to solve it, and I think many others are still trying. But
Right.
lameness, the reason why lameness is so important is the main reason for culling young sows out of the herds. And we invested a lot, so that has cost consequences to the economic viability of the farm, of course. But then it's also very painful thing that happens.
Right.
Yeah, it's just welfare compromise to the highest expression.
And what causes lameness in gilts and sows? What's the cause of this?
So lameness is the symptom, right? It's like fever. Any pathogen can cause it. Lameness, you can have a wound, you can have joint problems, you can have muscle pain, you can have an infection. Um, so there are several reasons that's important to have a proper diagnosis, but the main reasons that affect our gills and sows are from the development standpoint, the osteochondrosis or lesions that happen in the inside the joint that weaken the bone and the cartilage above it. And then you have hoof problems, all related to laminitis and that union between the flesh or the tissue and the hoof of the feet. That sows struggle and kick to places and get small wounds in that tissue, and that's the main reason for lameness in sows.
And I know you've conducted some research on osteochondrosis associated lameness and hoof and claw lesions. What did your research show? What did you learn?
So those were two separate type of lameness that we investigated through a similar approach, which was modifying growth rates, for instance, which should help lower the pressure as body weight on those developing joints or hoofs, and then trace mineral strategies. So what we learn is that nutrition can have an impact, but there is for sure a big background on the sow where the genetics, the management factors, the environmental, the farm facilities, all that play a big role on lameness too. So yeah, that's it's a multifactorial problem and it's hard to solve. So that's one of the things we sort of knew, but we when we planned proper studies and designed proper research for it, we realized it was not so easy. And we found some minor benefits of trace minerals, for instance, but yeah, there's still lameness happening. So complicated problem. That's
Right. And I don't know if you found this out in your research or if this is just more information, I guess we're looking for is when does the cause of lameness develop? And is it always with the gilt? Is it start with the gilt when they're young, or can it develop later with a sow?
So again, if we talk about these two main types of lameness or causes of lameness, let's look at osteochondrosis first. So this is a problem at the surface of the joint, but the damage is below it. And that damage happens when the bone starts to grow and changes and shifts from cartilage. Young animals have cartilage, they don't have the bone yet. And
Right.
this cartilage evolves towards bone and it gets mineralized. So when this process happens, there can be structural and physical damage that if it doesn't get resolved properly, then you have weakened areas. And that's very early in life. You can talk about 10 weeks of age or even earlier. We see a lot of lesions in young pigs. And then a lot of those lesions heal. So during the growth development, the healing of this lesion is key. 60% of the sows as gills will have osteochondrosis problems that will heal over time. So that starts very early. And that means we need to think about the nutritional and management strategies of future sows early in life. And for the second type of lameness or cows, we would think about the hooves and the problems around hooves. So there's a lot of stress on some microminerals and nutrients during the gestation and lactation periods of those sows, one after the other, one cycle after the other. That takes nutritional stress, basically, and demands. There's a higher risk of poor irrigated areas like the hooves to lack some nutrients that makes the tissue connection between the flesh and the hoof weaker. And there's a higher risk of inflammatory markers creating inflammation there. And what that union is weakened, then is a higher risk of a hit on a wall or an iron place or just fighting two cells. That stress will impose lesions, older cells, that means.
This is maybe an unusual question, but do sows or gilts need to have their hooves trimmed regularly? Is that, or is kind of being on the slats or being in different environments kind of wear them down enough that that's not necessary anymore?
That's a very good question and very important, Sarah. So the sows and the pigs in general, they need concrete. So the concrete really warns the hooves. But if you have too much plastic, then you don't get the proper worn effect. And then, yeah, I've seen some farmers and really small farms to take care of the hooves on the sows, but that's almost anecdotal. While in cows, we do that a lot. So it's a bit of a contrast between those two industries, definitely.
Huh, interesting. Very good. Lluís, what do you think about reducing growth rate to minimize or reduce lameness and gilts? I know you've done some research on that.
Well, that's a very good one too. It's been speculated, and it makes sense, right? If this gills grow too fast, the bones don't have the time to catch up with proper shift from collagen to or cartilage to bone. And there's data published on the topic that shows the reduction of lameness if you slow down growth. You could do that by feed restriction, which has some welfare concerns versus outlet, or you could do it by nutrient intervention if you lower lysine, for instance. We did in my research, we did it by reducing lysine to 20%, and we managed to slow down growth about 8%, although gills showed to be a bit fattier. But we didn't manage to reduce lameness, and others have achieved that. It could be also genetics, or maybe if you don't have the perfect storm in your case farm to show lameness due to that. I see it like reducing your odds, right? If you're a bit lighter, you have less chance that your damaged joint falls down under your weight when you're fighting another sow or you're playing, right? So it's like, yeah, if you are fit, you have less chances of hurting yourself, but you can still hurt yourself.
Right.
So put that in simple terms, I think that's it's not an easy one either, Sarah.
Well, let's move into a couple questions here about, or really about the nutrition, the role nutrition can play. What role do minerals, trace minerals, and vitamins play in helping to prevent lameness?
So yeah, you think about the bone first, and the bone is really this one structure with calcium phosphate that it takes a physical property with different areas, with different shapes of the bone that are like beams and walls of a construction, right? And then everywhere in between is filled up with cartilage, collagen, tissue, blood vessels going to the sides, and in the middle we have the bone marrow. So I already mentioned, right, calcium phosphate. That means that the main structure of the bone is going to be this mineralized structure. and calcium and phosphorus are key. And the ratio and absorption and metabolism will be key. And we've been optimizing diets to a level that is designed for growth, because phosphorus and calcium are very important for other functions too, right? But the ratio and the amounts needed for those two minerals is not the same for growth than for bone mineralization. So bone mineralization actually has a bit higher ratio. We're talking about 1.4 to 1 calcium phosphorus, digestible calcium to digestible phosphorus. And they are essential, but they will be playing a role mainly on the quality of this bone and the structures. You can think about fractures. Fractures happen very often when you're moving, or very often. There's a proportion of fractures happening when you move pigs to the slaughterhouse or when you move sows, if they fight and so on. So that can be important. It can be important during development also for the structure and the development of those bones. But then you have all the minerals that will be more important for recovery those osteoporosis lesions, like trace minerals, zinc, manganese, copper. The absorption of those and the level, the source that you use, all that will play a role on the availability of these micronutrients for the cartilage to recover when it's transitioning to bone. I think I answered your question, right?
Yeah, definitely. And you talked about calcium and phosphorus. What about sulfur?
Sulfur is a good one. It is a big component of collagen and the structure that is around this cartilage and the tissue in between the fibers of calcium phosphate. So sulfur will be a role in that soft structure of the bone, if that makes sense. Yeah, and then sulfur is also competing among, there are several functions of the body. And during critical periods, similar like trace minerals, they will be demanding peaks of oxidative stress, of immune stress, and so on. And if during that time we get the perfect storm, then these osteoporosis lesions might not heal properly. So yeah, big mineral too.
Yeah, what about trace minerals?
Yeah, I think I've touched upon some of them.
Yeah.
Zinc, for instance, right, it's the key in some of the processes that build up the collagen, and copper as well. They will be competing for immune system as well, and it's very important to make sure that we get the right ratios and that we use the proper levels that are available. Yeah, without too much of environmental contamination, right? Those minerals will be also released to feces. So yes, it's important that you think about what sources of these minerals are you using to make sure that there is no deficiency in critical points. That's how I would look at it.
Can they be antagonistic with each other or with other minerals, zinc and copper? Or maybe I'm confusing
Yeah,
myself.
no, those two and iron, the same
Iron. There you
receptor
go.
for acting. Yeah,
Yeah,
so you're
very
totally
good.
right. Yeah.
Okay. And are there any other supplements to consider?
Yeah, I think human nutrition is a good example. The problem is that when you translate that to the farm conditions, sometimes it's hard to find the right evidence because there are so many factors, and maybe we're not even diagnosing the right cause of lameness. But glucosamine or chondroitin sulfates, for instance, is a source of sulfate. They help develop that cartilage. Omega-3 have been shown good results in human nutrition. Manganese in some examples. It's been speculated, on the other hand, that sugars and quick carbohydrates can be detrimental if you have peaks of insulin that can hamper the bone development and especially, again, cartilage development. Folic acid, there are many options. Vitamin D, of course, will play a key role on calcium and phosphorus absorption. So yeah, there's a whole world of possibilities, but again, it is a difficult intervention.
And I guess my last question is maybe from the perspective of the producer, if you see lameness kind of developing in a few gilts or sows, I mean, that is an opportunity, right, to say what's not working here, right? That is a sign that your nutrition levels are off. Is that a fair statement,
It could
Luis?
be the first thing you want to do probably is to check out the management of that batch, and in terms of nutrition, look for any deficiency. There's going to be if you get an outbreak of lameness, it could be that also pathogens like mycoplasma play a role.
Right,
But there's a good chance that the nutritionist missed something in in the feed, or that you get yeah, the perfect storm, and then you want to look at potential interventions to solve that. Yeah.
right. So is the first step for something like that to take a blood test, I guess? Do some blood work or kind of figure out what's going on in these gilts potentially that have lameness.
There's high variability on what you can find in blood that
Right.
aligns with uh, with the clinics. But yeah, you can do that. There are markers that are associated to osteoporosis that could help. But again, you have the lameness in front of you. The
Right.
best thing is try to diagnose the reason. Then you
Right.
can think about what and so on. Um, but yeah, uh, there's several options and potential
Right.
reason.
So diagnostics of some sort, not necessarily
Yeah,
blood, in other words, but some type of diagnostic to kind of get to the root cause is what you're
yeah,
saying, right?
yeah. You could even think about a borderline genetic problem that is behind a group of cells. So yeah, there's a group of gills. So there's several options, and many possibilities of something going wrong.
Right.
But diagnose why your cells are lame, and then try to think about solutions.
That's the next step, really, it sounds like. So, very good. Hey, thank you very much for your time today. I really appreciate it.
Yeah, no problem. It was a pleasure to be here, Sarah. Yeah,
Yeah, I always enjoy hearing about some research, right? And what you're learning out in the field and in the research lab. It all helps it come together. So, thanks again for your time. I really appreciate it.
no problem. See you next time.
Yep. This is Sarah Mikesell with the Pig Site, working in collaboration with Life Start Swine.